Wonderful. So we are now live and we can,
All right.
yes, we are live now. Awesome. Well, so we're just going to go ahead and start, and I'm going to, okay, just, also, if you don't, if you can work on letting people in so that let me make you, yeah. Okay, you are co-host. Good. Wonderful. We call to the cloud. Okay, wonderful. Here we go again. This is another session of our Hormones Connection series. It's been amazing. We've had two. This is the third one. And I'm excited, very, very excited today because I have Dr. Shona with me. You are going to enjoy this session. She is a wealth of experience. I've known her for a couple of years, and she just knows so much, but in a very humble way. She doesn't, she doesn't act as if she has all that stuff, but she does. And I'm going to be discussing with her. So just like we did last week, this is also going to be question and answer, but I have the slides prepared so that we can just run through the slide, some of what we talked about, but not everything we talk about will be on the slide, but just so that you have some information. And as I always do before I start, I say a short prayer. Because my prayer is that this series brings healing. You find answers, and you are able to solve health situations that you've had for a long time, or not just yours, maybe a friend, a colleague, a family member. So, Father Lord, I just thank you for this opportunity to have Dr. Shona here as we look into the hormones and health and wellness, especially looking at chronic health situation that has caused sorrow to a lot of people. My prayer today is that the answers and the discussion will bring answers and will bring solution to so many questions. I pray this in Jesus' name, amen. Okay.
All right.
Good. Okay, so Dr. Shona, I'm so glad to have you here. I'm going to share my screen. I'm going to bring up my slides so that I can properly introduce you. I have your bio, and so let me just have that up here. Okay, so and then after that, we're going to into the question and answer session. Getting used to all the tabs. Okay. Okay. So this is courtesy of the Brain Gym Center, and we have today the hormone connection, hormones, and how it affects health and wellness. I have with me here Dr. Shona Babu Atwada. Did I pronounce that well?
You did. You did really good with it.
I was dreading pronouncing it because I didn't want to murder that name. Atwada. Okay. Awesome. And so I'm going to read our bio. And so we have Dr. Shona. Dr. Shona received a bachelor's, excuse me. No, I was trying to move this out of the way. Okay. So Dr. Shona received a Bachelor of Science, BSc in Biological Sciences from Mercer University in 1993. She's my alma mater. I also did my
Mhm.
PhD at Mercer University. And she received a Master's of Science from the University of West Georgia in 2001. And she specialized in holistic and integrative health. And an ambitious aspirant graduated from the University of West Georgia in 2012 with a Doctor of Philosophy, PhD in Integrative Health and Wellness. Dr. Babu Atwata is a cancer, weight loss, and overall wellness expert who assists our clients, medical patients, and independent professionals in meeting their health and wellness goal. She is dedicated to the vision and mission and purpose of creating a global ripple effect of patients, of patient empowerment, advocating accountability for one's own health and wellness. I love that because, it's easy to want others to fix you. It's like, doctor, tell me, just give me a pill, give me something, fix me. But then real health, true health is when we advocate for individuals to take accountability for their own health and wellness. And that is big, and that is where healthcare is going. And that is, the real healthcare. Dr. Babu Atwater's exemplary professional accomplishment consists of being a published author, entrepreneur, motivational speaker, patient advocate, talk show host of Proactive Health. She's also the Chief Operating Officer of Asiva Nutrition and lead instructor of Meta Life, a lifestyle empowerment program. She's going to be telling us more about Meta Life because we've been talking with them, with Asiva and Dr. Shona, about how to bring Meta Life to Nigeria. And so she will tell us a bit more about the result they are getting, and we'll see where that goes with us in Nigeria. She's board certified with the American Association of Drugless Practitioners, the Naturopathic Medical Association, as well as a member of the International Association of Health Coaches. Welcome, Dr. Shona.
Thank you.
It's so nice to have you.
It's
And
really
for
great
those
to be
that are
here.
meeting me for the first time, maybe this is your first time of attending this series. Just a brief profile. This is very brief. I also have my PhD in counselor education and supervision from Mercer University in 2015. I have my master's in marriage and family therapy in 2007. I have a doctor of chiropractic degree from Life University in 2021, BA in theology, BSc in microbiology, and various certification programs. And I am the host of the Hormone Connection under the Brain Gym Center. Okay, so Dr. Shona, I'm going to start with the first question on this slide. And I'm going to ask, how do hormones impact our overall well-being? And why is it important for us to understand their role in our health?
Well, no doubt that's a very good question. And I'm really, again, glad and thrilled to be here with you. Discussing hormones is such an important aspect of our everyday life. And when we think about, how hormones play a role in regulating various physiological processes, the list is numerous. I mean, hormones, of course, they regulate key functions. They're instrumental in our reproductive health. They are instrumental in our mood and our emotions, our stress, our immune system function, bone health, thyroid, blood sugar control, weight management, sleep patterns, aging and growth, cardiovascular health. So the list goes on about when it comes to hormones and how the fact that understanding them is important because it's crucial for our overall health.
Wonderful. Isn't it so interesting that hormones are small? They are just, all you need is just like a pin drop.
Yeah.
But they have such control over the body.
Yes.
And they remind me of when we talk about the rudder of a ship. that controls the ship. That the rudder of the ship is so small, but it actually controls the direction of the ship. And so for me, the hormone is just like that, in which it's so small, but it can wreak havoc. And we are going to see some of if things are not going well, it can wreak havoc in the body. And we are going to be seeing some of that today. So let me go to my next question here. I'm going to be going back and forth this slide. And and so you have the slide here, hormone, just like she said, they play a crucial role in regulatory various physiological processes in the body. And basically today we are going to be focusing a lot on the hormones that affect health conditions like diabetes, hypothyroidism, hyperthyroidism, hormone-related cancers, hormone-related reproductive health situations. So I'm going to go ahead and start with thyroid hormones, Dr. Shona. How do thyroidism and hyperthyroidism develop? And what is the best treatment modality?
Yeah, so no doubt this is a very great question, because when we think about, hormones in particular, when it comes to hypothyroidism or hyperthyroidism, the earlier you detect an issue in the management of these thyroid-related disorders or diseases, the more likely we can either prevent or mitigate the impact in our bodies. So when we look at hypothyroidism, that's basically the results of an underactive thyroid gland. And it's when the body doesn't produce enough of the hormones T3 and T4. So again, that's why we want to get our hormones checked regularly to see, where our T3, T4 is, reverse T3 uptake. Those are just some of the terminologies that a doctor would use when it comes to thyroid testing and thyroid health. And some of the terms that you may be familiar with when it comes to hypothyroidism is Hashimoto's disease, which is when the body's immune system attacks the hormone gland, the thyroid gland, excuse me. And then in the opposite of that is hyperthyroidism, and that's a result of an overactive thyroid gland. And the term that you may be familiar with when it comes to a hyperthyroidism is Graves' disease. And typically, when it comes to Graves' disease, there are physical things that you could see when, with an individual that may be an indication that they have Graves' disease, as well. So there's, different types of, treatment options when it comes to, addressing both of these. Again, early intervention is extremely important. Knowing where your thyroid levels are, getting those regular checkups, as well. And of course, with anything, having, balanced diet. We always start with diet, because, that is instrumental in many of our, body functions or physiological functions. But it's just some of the things from an allopathic standpoint that typically happens in treating hypo or hyperthyroidism is the antithyroid medications. The radioactive iodine therapy may be another one. And then sometimes in extreme cases is thyroid surgery, just to name a few of them.
So I asked two questions there. The first one is, especially for people that might be in places where it's difficult to get their thyroid, to go, it's expensive to always go and do all those testings. Are there things that they can look out for that might be a pointer? And when they see these things, they know that for sure I need to hit the lab now.
Yeah. Yes, for sure. Definitely. It could be, excessive weight loss, in some cases, excessive weight gain. It could be, sometimes it's the bulging of the eyes. It's typical when you look at someone with Graves' disease, their eyes typically tend to protrude because of the pressure. And making sure, as I mentioned earlier, having a balanced, diet, and iodine is one that's typically very common when it comes to thyroid issues. The bodies may not be getting enough or at the right ratios as well. So if the person is, maybe it's an increased appetite, I mentioned, weight loss or weight gain. It could be a rapid heartbeat. It could be irritability, heat intolerance, tremors. Sometimes it's a goiter. That's another physical attribute that we could see when it comes to a thyroid issues. And that's when you start to get a bulge right there where your thyroid gland is located. And we call that a goiter in your throat. So those are, again, some of the physiological symptoms that a person may experience. When there isn't lab testing readily available, those are key indicators to let you know that something may not be right.
Oh, good. So, I mean, you pointed out something very important, because as women, especially if I lose weight, I know I'm so excited. Oh my goodness, I'm getting rid of those pounds. I'm getting slimmer, and there's a tendency for you not to think anything is wrong. Because all of a sudden it's like you're not able to lose weight, your dresses are fitting better, you are looking slimmer. But what we are saying is that don't just take it as, oh, I'm losing weight. That is good. If it is, rapid onset, then it's important that it's important to go and meet your healthcare provider and ask questions, or just a rapid weight loss. Just everything you do. Like I say to people, sometimes I drink water and I put on weight.
Yes.
It's like, why would I be putting on weight? I'm drinking water. It's important that when you are noticing those two extremes, either you just keep gaining weight no matter you are not eating, even if you refuse to eat for the next 5 days, you are still putting on weight. And so it's important, like you said, for us to go and have a check. Now, I have a question, Dr. Shona. Is with the goiter, you've talked about allopathic treatment, and I know that you belong to the Institute of Drugless. You are part of the drugless medicine practitioners.
Yes.
I want to ask this question: have you seen any treatment that has worked for people having goiter?
Yeah. Well, it's interesting because, of course, each individual is different. And, for me, I like to start with the most simple approach, which is, doing some type of sensitivity testing, food sensitivity testing, to see if the body's overactive immune response is due to some type of inflammation trigger that may surprisingly start with food, in particular with gluten. What's interesting about the gluten protein itself is it looks very similar to the thyroid gland. So if a person happens to be sensitive to gluten, if that shows up in their lab, then we're doing what we call an elimination diet to reduce the inflammation that may be coming from, food in particular. And then from there, of course, doing the lab test to see where the hormones are, the thyroid specific hormones, or TSH hormones would be next. And surprisingly, we start to see some results from just a simple IgG, lab test and results to see if food is part of the root cause. And then from there, it's, making sure that the diet is balanced. It's, if we need to supplement, we may supplement with very specific herbs that are known to support the thyroid.
Can you tell us one or two of those herbs?
Yeah, well, speaking on the SIVA side, we have a product. It's called CT Reg, which is it's interesting that cholesterol and thyroid are closely related in how the body reacts or responds when it comes to stabilizing the thyroid gland itself. But herbs that are usually really good for thyroid health or thyroid support, or minerals that are also really good for thyroid support, is N-acetylcysteine, zinc, Selenium is another one, just to name a few. And then, of course, vitamin B6, which, if you're deficient in your B vitamins, typically there is some type of systemic issue going on within the body.
Wow, good information. And just to say that you start by just looking at the food.
Yes.
Because a lot of what we are going to be talking about today, as I looked at the topics, a lot of them, inflammation plays a key role in them. Yes. And whether it is inflammation that eventually leads to autoimmune situations where your body begins to fight your body. And that is what you see with thyroid, hypothyroidism, hyperthyroidism. You see a lot of autoimmune situations taking place where your body is actually attacking the thyroid gland. And as a result of that attack, things begin to go wrong. And so asking the question, why is my immune system hyperactive? Do I have inflammation? Why is my body attacking my body? And, something you said is like something as simple as doing a food sensitivity test. Yes. Or looking, finding, what food that are you reacting to that is causing this long-term chronic inflammation in your body. Yes. And you can do what you call the elimination diet. We've talked about that in some of our programs, where you are taken by, it's always helpful to have someone work with you to do an elimination diet to find what is wrong. And one thing I would love to do is actually do a group elimination diet, where as a group, we just, in planning for the new year, to get our bodies right in check, and maybe we get Dr. Shona to work with us and just walk through a group elimination diet and to see what are some of the things that are triggering and might be affecting our health. Yes. Wonderful. Thank you so much. So I just have some slides just to summarize what Dr. Shona has said. That you have various diseases that comes from the thyroid. You have Hashimoto, and she talked about the Hashimoto is as a result of hypothyroidism. You have the hyperthyroidism, which is the Graves' disease, which all of a sudden you start having bulgy eyes. And dry eyes, your eyes is not watering, it's just dry and it's bulgy. It's not that you are becoming, you are seeing better. It's that something is going on and it's time to get help. And then she talked about the different reasons we might have the thyroid. We talked about, injury to the thyroid. And that injury can be caused by your body attacking the cells, and can be caused by food sensitivity and inflammation in the body. Cortisol, stress, also attacks the body. And then she talked about the different things that we can do, that we need to, check. If you are noticing that there is a lump, then you want to check it. You can go and do a lab test. You can do an MRI, and this is a nice slide of how to check your neck to see if there's any lump in the neck. So when you go over this talk, you can pause and be able to read some of this slide better. That's why I have them there, so that you can go and look at it. And she talked about the T3, T4, which is the hormones that are produced. And what is fantastic about the thyroid, as she told us, is that they regulate all metabolism. And so when they are not functioning, you have fatigue, no energy. When they are over functioning, you are just on the go. And we've looked at the risk factors, and we've looked at some of the causes. So the next question I have, Dr. Shona, is what are hormone-dependent cancers? And what role do hormone play in the development of these hormone-dependent cancers?
Yeah, that's another great question when, again, talking about hormones and these hormone-dependent types of cancers. So there's breast cancer, which of course, we talk a lot about breast cancer in women, but men too are affected by breast cancer, and they also should do regular breast exams. There's uterine cancer, ovarian cancer, to name a few that are hormone related cancers. So in breast cancer, the hormone in particular is estrogen and progesterone are two. Then with uterine cancer, it's again estrogen stimulation that may trigger the endometrial cancer that comes with uterine cancer, and then ovarian cancer also is another hormone dependent type of cancer.
Okay. And so I think the the hormone dependent cancer, and then sorry. Okay, and so the development is as a result of estrogen. And so how do we get our estrogen getting out of whack? You know, why? Because I know that estrogen is a good hormone. It actually helps protect our brain cells. It helps with memory, sharpness, you know. It helps with the cycle in women and men also. Men also have estrogen. It's just that it's minute, you know. It's we all just like we have testosterone as females, but it's in a small proportion compared to the male. So that's why men can have breast cancer.
Yes.
Hormone dependent. So what makes this estrogen go out of becoming, rather than helping us, becoming a villain?
There could be definitely several reasons why. We also, again, you're going to hear me talking a lot about food, because food really, and the things that we put in our body are really the foundation of health. There's phytoestrogens, and if a person is not aware or cognizant about the food they're putting in their body, if they're ingesting a lot of phytoestrogens, that can create an overproduction of estrogen, which in turn can result in some of these, cancers. Now, of course, there's DNA, there's genetics, and some individuals may be predisposed or have a predisposition for these types of cancers. But often when one hormone is not balanced, it causes a trigger of the other hormone. It could be an overproduction or an underproduction of the other hormone because the body is not getting enough of what it needs. When it comes to phytoestrogens, for example, it's the reason why, most infant children, and males in particular, they should not drink a lot of soy-based formulas, because they can develop gynecomastia, which is, male breast. When it comes to our body's ability to regulate our hormones, making sure that we keep those hormone balanced. So often what we may do, or a person may have to do, is take supplements. It may be, we call them precursor hormones, which direct and tell the body how much of a hormone needs to be produced. Pregnenolone is one of those type of precursor hormones. There's also DHEA, which is another precursor hormone that tells the body, okay, you need more testosterone, you need a little bit more estrogen. So the body is constantly in this regulating and balance mode to help keep it at a place of homeostasis. The body just wants balance. And whether it's the foods that we're eating that have these phytoestrogens, or it is some other type of external catalyst that's causing our hormone to be out of whack, the body is again in that balance or that give and take to try to regulate them.
Okay, so meaning that now you said something that got me thinking, Dr. Shona, when you talked about now that we should avoid giving infants soy-based baby formula, because of, especially male, then I'm wondering, because I don't, it just got me thinking that what about the consumption of cow milk formula? Because we know that a lot of what we know now, that recently you have a lot of cows being pumped with estrogen. And we also know that that estrogen is going to be in the milk.
Yes.
So I begin to wonder if drinking cow milk formula, that not every one of them, but those that have high level of that are from non-organic cows that were pumped with estrogen hormones, if that also could not cause estrogen dominance in the body.
You're right. That's a very good point. And it is the probability is very high. That's why when you go to purchase beef or bovine, you may, or even, other food in the beef or I wouldn't say like the chicken or poultry category, you would see things that may say RBST free. And that RBST free is letting you know that that particular cattle was not raised with hormones or was injected, with hormone or any other animal protein that we may be consuming, making sure that it says that it's hormone free, because the farming industry, they inject, our food with these hormones because they want to either grow the cattle quickly or grow the chicken quickly, and not really thinking about the impact that may have on the consumer, on us that, are eating these foods, that it can throw our hormones out of balance or out of whack, or cause some type of issue within our body because we're, taking these types of hormones unbeknownst, to us.
Wow. And so viewers, it's important because it's almost like an epidemic of cancers, and since we are talking about hormone dependent cancers, that most of those cancers are caused by hormonal imbalance, especially overproduction of things like estrogen. It's important for us to become more mindful of the food we eat, because Dr. Shona, from her experience, keeps saying food is a big culprit in a lot of the health conditions, the kind of food, what we put into our bodies. And so we need to be more mindful and read labels. And as much as possible, as much as we are able to, we should reduce our intake of hormone-grown poultry, beef, protein products. And for those of us that have babies, we should look at if we are going to give formula, if we cannot breastfeed. If we can breastfeed, please go ahead, and you are safer as long as you're also not pumping hormones into your body. You are safer giving the baby the breast milk. But some people might have challenges with breastfeeding. Read the label for the formula, to ensure that the milk is not from estrogen-fed cows that produce that milk, so that we can keep our children safe. Because nowadays, even infants, babies are having cancers.
Yeah.
And as much as we shout genetics, I think that the environmental factor play more role. The epigenetics play more role than the genetic factors, and so it's important that we take note of these things. And I'm just going to go over, okay, we move this. So the next question I have, and then I will go back again, I still have another question on the hormone, is, talking about insulin and diabetics. That is also an epidemic. You talk to people, is either they are people that are diabetic or they have high blood pressure. That, cancer is on one side, but that being diabetic and having high blood pressure seems to be like, almost like, okay, I mean, it's like the order of the day. And so I know that that is an area that you've worked a lot on.
Yes.
And you actually have a program that is approved by CDC in the US as a pre-diabetic management program. So Dr. Shona, can you tell us a bit about diabetics and about what you have done and the success your success stories?
All right. Yes, absolutely. So this definitely is dear to my heart. It's the National DPP, which is the National Diabetes Prevention Program. I am one of the master trainers or master lifestyle coaches, for that program within MetaLife as well as with the CDC. About 1 in every 3 individuals, speaking in America, and of course I could get global statistics as well, but in America, 1 out of 3 are pre-diabetic. And about 88 million of the US population does not know that they have pre-diabetes. When it comes to diabetes, there's 2 types. There's type 1 and there's type 2. And, the body's ability to, regulate the hormone insulin is important when it comes to either preventing type 2 diabetes or helping an individual learn how to manage their type 1 diabetes. So the CDC has recognized that this is an epidemic. It's a global health concern. They have worked very closely with individuals like myself and other health organizations to really educate the public on what they need to do to prevent type 2 diabetes, and really, have various case managements or helping individuals to see what are their risk factors for developing type 2 diabetes. And what it is the body's inability to control blood sugar or blood glucose. And that's glucose is the sugar levels within your body. Type 1 diabetics are insulin dependent. They need insulin. Their body isn't producing it. Whereas type 2 is food related. Again, there's the food contributing to what may cause an individual to develop type 2 diabetes. In addition to food, there's the lifestyle factors as well. It's, they're, managing stress. It's, getting enough rest, sleep, and different lifestyle factors that may contribute to type 2 diabetes. So the MetaLife program is recognized by the CDC as a diabetes prevention program, and we work closely within individuals and communities to help them to reverse type 2 diabetes if they've been diagnosed to be predisposed for it, or to eliminate all of those risk factors altogether.
Wonderful. And how has your success rate been?
The success rate has been very good. I mean, or can I say exceptional? And I say that because, we work very, very hard when we are enrolling cohorts into the program to really ask a lot of questions, and look at their risk factors and really qualify them to be enrolled in the program, so that our success rate in helping someone to reverse type 2 or to remove the risk factors for developing type 2 are completely eliminated. So I'm happy to say that when we enroll cohorts into that program, we have a 100% success rate for individuals. Wow. Stay the entire time. We monitor them for a year. And within that year, that data is compiled every 6 months. I have a report that I present to the CDC. My data is cross-examined very, with scrutiny by the CDC statisticians to make sure that all of the analytes or risk factors that we're checking for are in line with their program. And then they give us the results. And
wow,
we're
can you summarize just briefly some of the things that you do in the program?
Yes. So it's a one-on-one consultations. There's also group sessions. Individuals have handouts that they are given. We meet weekly with their health coach. It's broken into, we call them core sessions and core maintenance sessions. The core sessions last 6 months. There you're learning about stress management. You're learning about reading labels, how to cook healthy, getting exercise in regularly. The program requires that an individual does at least 150 minutes a week in some type of exercise. You're learning about your support system. What else? Eating out. When you have to eat out or have fast food, what are the healthy options when you are faced with social influences that may throw you off of course, so to speak, with your goal? It's about 12 months of information that an individual is getting constantly, because the goal isn't just to lose weight, which is a side effect of the program, is to help an individual see what are the decisions they need to make so that this is part of their lifestyle. It is what it is. They aren't going to allow social influences to deter them from making a wise health decision when they go to the grocery store, when they're out to eat with friends and family, all of those things. We want it to be a lifelong initiative.
Wow, thank you. I'm so excited. I'm like going, count us in. We are going to talk about how you're going to train some of us here as coaches for the Meta Life, and we're going to see what we're going to do with that in Nigeria, because there are a lot of people that will need that, that mentoring and help.
Yes.
And for you to say it's 100, you have 100% success, then we want to be part of it.
Yeah, absolutely. And it's great that, and I've watched the progression of the CDC's program evolve, so to speak. It was very cookie cutter, but understanding that, you have individuals from, different nationalities, different backgrounds, foods that may be staples in, an individual's household, making sure that the program is very well-rounded to include, to be more inclusive and not just based on the standard American diet, but foods that may be indigenous to other areas, and how can those individuals be helped to reverse type 2 T2 or prevent T2 altogether.
Wonderful. We would definitely be willing to work on that with you. Okay. So she's talked a lot about diabetes. So this is just a slide that summarizes, she talked about insulin, and that it can be low production or insulin resistance. And you have the type 1, that type 2. Type 2 is the common one. And then you have the gestational diabetes in pregnant women. The next thing Dr. Shona would like to talk about is I think I jumped. We want to talk about reproductive hormones that affect reproductive health issues. So we have things like polycystic ovarian syndrome, ovary syndrome, uterine fibroid, and so, and any other reproductive health related hormone dependent reproductive health issues. How often do you see polycystic ovarian syndrome and uterine fibroid in your practice? And what has helped?
Yeah. So unfortunately, it's extremely common, especially in the African American community. Uterine fibroids it's prolific, as well as PCOS, or polycystic ovary syndrome, which is several cysts, that kind of accumulate, within the female organs. Unfortunately, it's very common. And often it is again, diet plays a key role in developing either uterine fibroids or PCOS. We had talked earlier about, physical things or things that may be happening within the body to let us know that something may be off, and to go see our doctor, speak to our doctor. And when it comes to PCOS, often just physically looking at a female, you can get some hints that maybe there is an issue with PCOS, because the male pattern type of hair growth around the chin area becomes very evident and very profound. Of course, then there's the irregular cycles, the periods. They may be extremely heavy. They may last longer than the typical 28-day cycle. And those are just indicators that I may need to go get checked to see exactly what may be happening within my body.
Yeah. And it's unfortunate. Honestly, we ignore. It's just so difficult, Dr. Shona, getting up to just jump up to say you want to go and see.
Yeah.
I'll be honest, many of us hold on to this. You have heavy periods for years, and I have people saying to me, my pad becomes soaked in 1 hour.
Yeah.
And sometimes people just feel like, okay, some people, because we don't even talk about it often enough, some people start their period heavy and think that is normal.
Yeah.
They start with 7 days, from the age of 12, 13, when they started. And it never dawned on them that, this is, this is, it's just too heavy. And so I wonder, Dr. Shona, what about when people start their period, so it's not like they are 30, they are 40, and then they just have this heavy period, but they start their period out heavy, 6-7 days. What's going on?
Well, and that's a good point too, because it is not normal to have, very heavy periods like that. And understanding that the body's main objective is homeostasis. It needs balance. It wants balance, and making sure that there is the right amount of estrogen within the body is extremely important. So, again, we want to start with the diet to make sure that we aren't eating something that may be contributing to this, I would say, slightly abnormal cycle for a woman or female. In addition to that, if it's weight, because weight also plays a role in our body's ability to regulate the hormones. If it's, insulin is, out of balance, the heavy weight is causing an issue. If weight is a factor, then losing weight may also contribute to having a cycle or a period become more normal, as well, because as weight goes down, body hormones start to regulate, and the body can self-correct itself. The two hormones, we haven't talked about this in this particular presentation, but there's two hormones that affect weight gain. It's ghrelin and leptin. One is your feel hungry hormone, and the other is your feel full hormone. And if your ghrelin, your feel hungry hormone, if it's not getting shut off the way that it should, and you're, overeating, and you're, starting to have excessive weight gain, then that can contribute to, heavy cycles.
Wow.
So things that we can do to make sure that we, again, the body needs homeostasis, it needs balance.
So how do we shut that down?
What's that?
How do we shut down that hormone, the ghrelin, right? So how do we, if it's refusing to shut down, how do we shut it down?
A lot of it is making sure that we're getting enough fiber and protein, and eating
enough fiber.
And eating slow is another way to make sure.
Oh, wow. Eating slow.
Slow,
Many
absolutely.
of us are eating in the car, eating while walking.
Yes, all no
Uh-huh.
good.
It's
All
not good.
No, you'll be surprised that if you take your time and eat slow and chew, I would say maybe 15 to 20 chews to really almost basically masticate your food to where it's almost liquid, then swallow, you will get fuller faster because you have now allowed your stomach to communicate with your brain that you're actually full. If you're eating too fast, it doesn't have time to make that gut brain connection and
Wow.
let you know that you're actually full. So you end up overeating when you eat fast or when you're on the go.
Uh-huh. I
And that
need to change
contributes to
that. I
weight
think
gain.
that will help me lose weight.
Yeah. Yeah. Something
So these are,
simple, but at the same time, very, very effective.
yeah, very simple and effective. This is just some pictures of showing us uterine fibroids, and we've talked about estrogen dominance. And this is uterine fibroids, real life with uterine fibroids, and just shows you what estrogen, off balance, imbalance, estrogen progesterone imbalance can do, where it just begins to feed. It's looking for, you have this excess, and your body does not like excess. Your body does not waste. Your body looks for something to do with this excess estrogen.
Mm-hmm.
And then your body just feeds it to the muscles in your uterus. And those muscles just start growing. They are feeding on the estrogen because the estrogen, so they become a mop. So it's your body's way of trying to find a solution because, as Dr. Shona said, your body wants homeostasis. Yeah. Homeostasis is balance. And so to have that balance, the estrogen needs to be mopped up. And your body mops it up by carrying it into the muscles. And then because the muscles is not made for them, so the muscle, they just begin to increase, just multiply the muscle cells. They are multipliers. And then you now have this. And estrogen, I believe that when we talked about even at a young age, I believe that even high cortisol, high stress level from even the womb, can prime you for estrogen dominance. Part of my research, Dr. Shona, was on uterine fibroid and the effect of emotional stress and stress reactivity. And I found out that women that have high level of emotional distress, stress reactivity, had bigger fibroids, meaning, that means the estrogen was there just pumping in. And so I said to people, even in pregnancy, you can begin to feed estrogen, what will prime the child for estrogen dominance by just the stress you pump in, cortisol. And I looked at this, what you call it, I looked at this graph that, for instance, when we all make the stress hormone, cortisol, from cholesterol, and it is the same cholesterol that makes progesterone and makes estrogen. And if we have a lot of stress, our bodies want to make more cortisol. And when our bodies make more cortisol, then progesterone, gets converted to cortisol. Yes. Because we need more cortisol. And what that happens is that estrogen becomes dominant. So the progesterone is not mopping up the estrogen. So there's no longer that delicate balance. So estrogen is just floating about, looking for where to hang out. Yeah. Because the progesterone is being turned into cortisol. And so estrogen now goes into the muscles and start hanging out there, and then begin to cause uterine fibroids and other whatever stuff that high estrogen will cause. So cortisol, and that can be primed from from a very young age, even like I said, even in the womb. And this is PCOS. And, you are experiencing irregular periods, ovarian cysts, infertility, acne, decreased breast size, So
Yes.
as I read this, as I was going through this, I remembered friends that I've had that we didn't know. We were we were in college. There was no test, but all the symptoms were there. Decreased breast size, hair on the chin,
Yes.
Irregular periods. And it's almost like, you feel bad riddance to this period anyway. Let it be regular. If it doesn't come for 5 months, I'm fine.
Yes.
And you don't realize that it's not just that the period is disappearing. There's something going on. The small size of breast, the hair on the chin and on the chest, and a change in a female body shape to begin to look more male. The hip is not coming out. All those things are not coming out. Then it's important to go and check and find out what is really going on with this. And the PCOS, as I said, cortisol again, is linked with chronic inflammation in the body and in the ovaries. And this chronic inflammation can be caused by cortisol, chronic stress. And it also, sexually transmitted diseases can cause chronic stress in the ovaries. So we should, genetics, and then insulin, we go back again, insulin resistant. We go back again to this cortisol mix. And so if you are experiencing any of this, then you want to seek help. There are different help, lifestyle changes, like Dr. Shona said. There are hormonal therapy. There are insulin sensitizing agents. There are things that will help to mop up testosterone, because they found that women with polycystic ovary syndrome have higher level of testosterone, the male hormone, and then lower level of estrogen. So this is almost opposite, is on the opposite side of uterine fibroids, where you have dominant, dominant estrogen. Here you have dominant testosterone, and that is also not good. And we've talked about all of this, the cancers. I'm just going to move there. As we round up, Dr. Shona, I know that there are some things that we call hormone disruptors in the environment.
Yes.
And how, I want to see how many questions I have left. Hormone disruptors in the environment. What are some of these hormone disruptors, and how do we get very far away from them?
Yes, another very, very good question. Again, a lot of this can be linked to our food. So one very common one is phthalates. And phthalates are found in plastics. So sometimes we get together, we go to a family, reunion, and they give us this little red cup. And everyone knows about the red cup, that they drink out of the Solo cups, and not to put any particular brand, on blast, so to speak. But there's phthalates in there, and phthalate is what makes plastic bendable, basically.
So you're saying that there's phthalates in my bottle of water, right?
It depends on the recycle code. So there, you can actually look at a recycle code on the bottom of plastics, and it will tell you the type of plastic it is, if it's phthalate free, or how it would be processed when it's time to be recycled. There's several different recycle codes. There's 1, 3, 5, 7, 9, 7 HDPA, PLE. It's a big list of them. That really, we could have another meeting just to talk about recycle codes and phthalates. In addition to that, it's BPA, which I just mentioned, which is bisphenol A, which is a hormone disruptor. We call them endocrine disruptors. There's pesticides, there's dioxins, there's parabens, there's heavy metals. So these can either come from our food, they can come from our makeup, they can come from our skincare, they can come from our, personal hygiene products. various ways that these, either paraben, dioxin, a heavy metal, BPA or phthalate, or even pesticides can infiltrate our body and really disrupt our hormones. Our skin is the largest organ that we have, and anything that we put on our skin goes into our body. So it's really important that we're reading labels and we are looking for, ingredients that may be used in the making of these products, that we're very, cautious about what we choose, because it can have an impact on our overall health.
Well, that is a big one. And I think that, as you said, that is a big topic just by itself. Just looking at hormone disruptors, and being able to read labels. And you've talked about so many things. So I think even talking about personal hygiene products, makeup, you have a lot of metals in being used in cosmetics, I believe. Yes, you have
absolutely.
Even in the soap we use, and just as you said, the body is the biggest organ, and the fact that water, when you are using those things, you now have a carrier, water. So it just moves straight into the skin because the water is there to help carry it. And so I think that will be a conversation, a whole conversation on its own, on looking at how to choose personal care products, how to choose cosmetics, how to choose soaps and all those things that will become that should be healthier. Or maybe we should just start producing our own. I used to do that at some point. I used to make my soap. And so it's time to go back to start making my soap and making my body cream by myself. And ensuring that I get it right.
Yeah, you were speaking my language, because it's interesting that when we look at what our ancestors did and how they handled their personal hygiene, they didn't have the fancy, speaking of female health in particular, they didn't have the fancy pads that they make today. So convenience has been a demise of our overall health. Back then, women, my grandmother, my great grandmother, they used, a rag that was something natural. It was cotton, a natural product, to absorb, their bodily fluids for that time of the month. Now we have these, pads that are made with all kind of chemicals, that are put near the most sensitive part of our body. We have to think about that. We have to make better decisions when it comes to that. There are creams, my grandparents, my grandmother, they use natural things. They use coconut, oil. They use, shea butter. They use those things to keep their skins moisturized and smooth. Now you look at the list of some facial moisturizers, and the list is about this long of chemicals, chemical, all the way through. So we need to get back to the basics. We need to read labels. We need to be more empowered with the decisions that we make when it comes to what goes on our body and what goes in our body. Dr. K, when you first started this this meeting, this webinar, you open with prayer. And I talk about, like, and I don't know everyone's, religious affiliation that's in the meeting, but I'm speaking for myself as a Christian, and knowing that in Christianity, the very thing that caused sin and death to come into the world was something that was chosen to be eaten. So it was food that impacted mankind to where we are right now. And it's food that's still the culprit of what causes us to have bad health and what contributes to sickness. So for us to, make better choices and be empowered, to be in control, to make sure that we're eating healthy, that we're putting healthy, products on our skin, is something that we have the responsibility to do. We have the power to do it. And we just need to educate more and have more of those conversations in order to be a healthier individual, to have healthier families, to have healthier communities, to have healthier countries. It starts with us individually.
Well, thank you so much. I mean, you talked about something, you know, especially when it comes to women's health. We really don't have a lot of conversations, you know. You talked about even sanitary towel. How many young girls are educated enough to know that that tampon, that thing they are buying, that looks so nice. You know, I don't want to name the brands, but one popular brand, especially in my country, you know that. And what they use are synthetic materials.
Yes.
That, you know, should not be going near there.
Yeah.
But, you know, nobody really talks about it so much. So a large number of girls grow up, you know, just picking up these things, you know, because that is what is presented. Because you start your period at what age? 12. You know, you are not reading labels at that time. You are not, what you call it, going online to check for what kind of sanitary. It's what they push at you. Somebody gives to you, you start with. You know, and so especially as parents, we need to, you know, parents that might not even be having their periods anymore, you know, talk to them to be more conversational about those kind of things, that it's not just any sanitary towel just because it smells nice, you know, they put perfume on it, you know, that can lead to a lot of what we are struggling with now. You know, that it needs to be as simple as possible. It needs to be 100% cotton to go down there.
Yes.
You know, and so honestly, Dr. Shona, there's a lot that we need to, I think what we need to do is sit down and make short videos, you know, just talking about, you know, some of those things, because I mean, we just have an epidemic of, you know, health issues, you know, hormone related health issues. And that is why this series is so important to me. And a lot of people don't realize how important this series is. You know, because if they do, I mean, it will be wonderful, because this is a very important part of life. My last question, because I have a number of other questions, so I'm going to let me see. I'm going to, yes, you've provided us with case studies. You know, once if you have an imbalance, Dr. Shona, is there is it possible to balance it? How, you know, I think I've asked this question before, that what are some signs and symptoms to know that something is going out of whack? I think you've answered that. And then you've talked about dietary or nutritional recommendation, but you know, is there any, just on a general level? So two questions in one. You know, when the hormone has gone out of balance, is there a way that we can, you know, are we able to balance it, or you are stuck for life? You know, nothing can be done. And then are there some food that must enter our system if we want a balanced hormone?
Yeah. All really great questions. I'll circle back around to, you know, what you mentioned about, are there things that we should look for? And one of my biggest recommendations is to always be in tune with your body, like pay attention to your body. Often innately, we start to get clues that something is wrong. We don't want to ignore those cues that our body may be giving us in very simple things. It's not, well, I've always had irregular periods. It's just part of life. You know, there's an underlying reason why that we have to look for. We have to find out what the underlying cause is. You may just go to put your hand on your hip one day and you happen to press a little bit harder in your ovary section than you did before. And then you may say, you know, I don't think I've ever felt that lump there before. Like, what is that? That may be a cue. Or you go to, you know, touch or rub your neck and you thought, man, I don't recall, I feel a little nodule here. I don't think that was there before. Breast exams. So there are things that we can do to help identify or have some type of early intervention. And once there is an imbalance, of course, each individual is different. We could either correct the imbalance, or if the imbalance is one that's very challenging, we can make steps and protocols and have those things in place that will lessen the impact or the symptoms or the lifestyle impact that it may have on us. So one, we need to identify the underlying cause. What is it? What's causing it? Is it hormone imbalance with too much testosterone, not enough estrogen? The precursor hormones, we don't have enough of it because age also declines certain hormones like DHEA for one. Do we need pregnenolone to as a supplement? Do we need DHEA as a supplement? If our estrogen is low, can we eat more phytoestrogens to kind of get it balanced? So there's this give and take. There's lifestyle changes. Does it mean that we reduce stress? Are eating healthy diets as well? Lifestyle change. When it comes to medications and hormone therapy, of course, because of what I do, it's always from a natural standpoint, but at the same time not anti-allopathy, because depending on the severity of the imbalance, a person may need to take some type of allopathic therapy to get things on the road to be stable, and then eventually be able to backfill or substitute it with something natural. And then time, on it, in certain instances when the hormone imbalance is something that can be easily corrected with just some simple food changes, it could be a couple of weeks. When it's a more challenging hormone imbalance, it could take several months, 3 months, 6 months. So it depends on what an individual is going through, but time is a factor. But to answer your question, it could either be reversed or it could be managed. Yeah, considerably. And then compliance, you have to comply. If the recommendation is to do XYZ, you have to be willing to do it. Not, I've been eating this way all my life, or I've been doing this, since, my grandparents, have been doing it. Sometimes, we have to be the catalyst for change when it comes to things that may have been passed on from generation after generation, as well. I have a cute little story when it comes to that. It's this mother was preparing a ham, and when she was preparing the ham, she cut both ends of the ham and put it in the pot. And her daughter asked her, like, why do you do that? And she was like, well, I've always done it this way. My mother did it. Let me call my mother and find out why this is the case. So she called her mother. And I don't know if anyone's heard this before. So her mother said, well, I've cut it because that's what my grandmother said. I mean, that's what my mother did. So she said, let me ask your grandmother. So she called her mom, and her mom said, well, I've always done it that way because that's how my mother did it. Let me call her. So then she calls her mother and said, why do you cut both ends of the ham? And then she said, I only did it because my pot was too small.
The pot was too small.
Yeah, the pot was too small. So often we do things generation to generation because it was just handed down with no reason or explanation as to why. So even when it comes to certain choices or lifestyle or health related, we have to find out, well, what is the reason why, this particular thing that's been handed down to me is the case? And if I need to make a change, am I willing to make the change? Because it's going to have a greater impact, not only on my life, but the life of those generations to follow me as well. So just something to think about when we talk about being able to balance hormones, keep them regulated, and helping the body to reach balance or homeostasis.
Wonderful. Honestly, you have wowed us, and you have given us just beautiful answers. We have learned so much. I think we'll ask you to come back next week. If you are going to be able to come back. We are like, I think you need to come back next week. You definitely need to be with us next week. This has been wonderful. Next week, we are going to be talking about how hormones affect sex and aging.
Yes.
You know, oh yeah. And I mean, I know that, you are definitely doing some things right because you don't look your age.
Oh, wow. Well, thank you. It's a labor of love.
Yes. And then Dr. Shona is the Chief Operating Officer for ASIVA. And if you want to learn more about, and she's talked actually, she's very instrumental in many of the supplements that are produced. And they've done a lot of research. You've heard her talk and on making sure that people have supplements, especially doctors have good supplements that they can use with patients. The service, their sister organization, Align Life, has over 48 clinics, and those clinics use ASIVA in the clinics. And so if you want to learn more about the products, go to asiva.com, ACEVA.com, and you will see. And if you have any questions, don't hesitate to reach out to us because we also carry some of those products in Nigeria that we use for what we do in our center. And my number is 08076769734. And you can ask questions. And we also will be planning an elimination diet program. And we're going to talk to Dr. Shona on how to do this and see, a group elimination diet program that that will help us get rid of some of these things that is troubling the body. Thank you, and I'm going to allow you to ask questions. I know that last time I had asked most of the questions, and so people were like, we didn't have any other questions because you've asked almost all the questions. I know that there are people on YouTube, so sometimes it's difficult for us to get your questions. But if you have any questions, please do type it, and the person over the YouTube will read it. But for the few on Zoom, do you have any questions? If you do, we have a few more minutes to just take the questions. Please type your questions if you have any questions. I'm giving you us a few minutes to do that. Okay, well, it's almost like I'm doing such an amazing job. It was like that last week when I asked any questions. They said you asked all the questions we would have asked. And so that means I'm doing a good job in asking all the questions that you might have wanted to ask. Is that it? If that is the case, do me a thumbs up that I have asked all the questions you would have liked to ask. Can I see if that is true? Can I see a thumbs up? I hope you are still with me. I can't see. Let me see. Because I'm checking to make sure that you can hear me. Okay, I can see. Okay, I can see a thumbs up. Okay, thank you. Thank you for letting me know. Thank you so much for being part of this Hormone Connection series, where you can always reach back out to send an email, ask questions, and we look forward to seeing you at the last for the last session, which is next week. And then we're going to have this out for replay for 1 week. And so you can watch it, you can share it with people for the next 1 week. And we look forward to seeing you next week. lessons. Thank you so much again, Dr. Shona. This was just an amazing time.
We
It was
have to do it
amazing.
again. It's good. I mean, it was a great topic and glad to be a guest. So thank you very much for everything that you're doing. Really appreciate it.
Thank you. Somebody asked a question and said, can exercise help with balancing hormone? Oh, yes. Definitely. Yes. Definitely.
Thank you. Then I'm getting back at it.
Yeah, getting back at the exercise. Oh, yes. It will balance.
Yeah.
Oh, yes. Movement, because one, it reduces stress. It helps you to produce good hormones,
Okay.
and just the shaking is almost like when you shake things up, you shake things back together.
Okay.
But it does, yeah. There's a lot of science behind it. I'm just using the easy word for it, that you shake things up, you shake it back together. But there's a lot of science behind, exercise. There's a lot of science behind it. The exercise helping to improve hormonal imbalance.
Thank you so much, Ma.
Thank you. Thank you for that question. Thank you. Okay, then, Dr. Shona. Bye-bye for now.